Myeloproliferative neoplasms, or MPNs, are a group of rare progressive blood cancers that affect about 200,000 people in the U.S. Welcome back to our continuing series, Behind the Mystery. Today's topic focuses on a group of rare blood cancers known as MPNs, specifically Polycythemia vera, which causes the overproduction of red blood cells, which causes the blood to thicken, and that can lead to serious health consequences. Here to shed some light on this rare blood cancer is oncologist and hematologist Dr. Shahar Pelles and his patient Arthur, who's diagnosed with PV. Thank you guys for being here today. So doctor, let's start by talking about what is Polycythemia vera?
So Polycythemia vera is a rare blood cancer. It's part of a group of diseases called myeloproliferative disorders. In Polycythemia vera, the body overproduces red blood cells, which leads to an increase in the red blood cell count, but these patients often also have an increase in the white blood cell count and the platelet count as well. It's a rare disease. There are only about 100,000 individuals with Polycythemia vera living in the United States, and with many other rare disorders, it's therefore often overlooked and poorly understood. This overproduction of red blood cells leads to thickening of the blood, which can then lead to blood clots, and that may include DVTs or deep vein thrombosis, but also heart attacks and strokes as well.
So doctor, can you tell us what are some of the signs and symptoms of PV that we should be looking for?
So many of the symptoms are fairly non-specific. Patients may present with fatigue, headaches, dizziness. Many of the patients report sweats. Itching is a symptom that maybe is a little bit more specific. Patients tend to report more itching after they take a hot shower. Because of something we call splenomegaly, which is enlargement of the spleen, patients may report discomfort or pain on the left side of the abdomen, or something we call early satiety, which is as the spleen presses on the stomach, they report a feeling of fullness after eating just a few bites or very small amount of food.
Now, some of these symptoms sound, relatively common. So is Polycythemia vera difficult to diagnose, and do the symptoms present the same in every patient?
Certainly the symptoms can vary between patients, and the symptoms experienced and the intensity of the symptoms can vary within an individual patient over time. Some patients are asymptomatic. They may be diagnosed because they have routine blood work that reveals an abnormality with elevations of the blood counts. And so it really underscores the importance of raising awareness of this disease, both amongst patients and medical professionals, so that patients report these symptoms and have them evaluated, and that physicians recognize that these symptoms may represent a diagnosis of Polycythemia vera and make that diagnosis and institute the correct management.
And Arthur, I'd love to hear a little bit about your experience. You were diagnosed with PV. How did you find out that you had it?
About 10 or 11 years ago, following a routine annual physical, my internist felt the blood results were out of the ordinary and referred me to an oncologist hematologist who ran additional blood work and then suggested a bone marrow biopsy. The further blood work showed more abnormalities. The bone biopsy was scheduled. I was hesitant about that, but then fortunately it was a totally painless procedure, and that confirmed the diagnosis of Polycythemia vera.
So doctor, is there a cure for PV?
So there is no cure for P. vera, but with the correct follow-up with your doctor, the disease can be managed and the symptoms can be controlled.
Do you have any advice for people out there who might be finding out that they have Polycythemia vera?
The best advice is find a good oncologist hematologist and follow up as often as possible, as often as he recommends, to make sure the blood values are kept somewhat within check. And also check the website, voicesofmpn.com is a good resource for information.
Well, thank you both so much for being here. Thank you, Dr. Pelles. Thank you, Arthur. And as Arthur mentioned, if you want to have more information on Polycythemia vera, you can visit voicesofmpn.com, or of course, you can always go to our website, thebalancingAct.com, for more information.